Thank you, Chairman Barrasso, for holding this hearing, and I appreciate your invitation to join this Indian Affairs Committee hearing. I'm a member of the House, and obviously this is a Senate committee hearing, so it is very humbling for me to be a part of this process and to be invited to join the group at the table today and listening to our testimony that we'll hear. Also, thank you to Senator Thune and Rounds for being great partners in having ongoing monitoring of HHS, IHS, CMS as we've gone through this crisis, and over the years as they've dealt with this before as well. Thank you all for coming here to testify today. Mr. Bearshield, you've been very candid with me, and you always speak with great truthfulness, and I know that the words that you speak are factual, and they've been very helpful to me when I've been dealing with drafting legislation and hearing the testimony of your tribe. The frank analysis that you give me is extremely helpful. And Dr. Wakefield, I do appreciate you making this a priority. It certainly is for all of us here at the table. And the fact that you came here today means a lot. Ms. Stabler, Ms. Blueshield, Ms. Bolin, thank you as well for coming. It's wonderful. And Ms. Smith, thank you for being here as well. I wasn't quite sure you'd make it, and I'm glad that you have. It means the world to me that you recognize how important this is. And I'm grateful that we're all here today to shed some light on the ongoing tribal health care crisis that we have going on in South Dakota, but frankly throughout the Great Plains region with tribes that include Nebraska as well. We need comprehensive reforms, and frankly, I'm just going to put this very simply. I believe that IHS should get out of the hospital business. I think they're terrible at it. I don't think they know what they're doing. And I believe this for two different reasons. First, as everyone in this room is aware, the medical care that we receive in IHS facilities in the Great Plains region is like getting health care in a third world country. The mismanagement, the fiscal stability that is lacking in the area and the agency have just completely eliminated my confidence in the agency. We found that the agency avoids transparency and openness. We found it keeps patients and tribal leaders in the dark. It's extremely discouraging to me, and it's incredibly difficult to get answers to the simplest questions. For example, the IHS has told us that it needs more people. We asked them how many employees the IHS needs, and we're told by the agency that it has no way of finding out this information. How do you make a request without knowing what you're requesting? And if you're a tribal leader, timely or accurate information is even harder to come by. To use one recent example, IHS notified Great Plains tribal leadership of an important conference call regarding the contracting process by sending a Microsoft Outlook meeting invitation 1 hour before the call was to begin. Now, we all describe the term of tribal consultation differently, but I tell you, that is certainly not it. On my most recent visit down to the Rosebud Hospital, it was just a couple of weeks ago, every single conversation that I had was people are sick and tired of the decades of corruption, the mismanagement, the life-threatening care provided by Indian Health Services. They're done with the bureaucratic mess, and that they are tired of watching underperforming employees risk the lives of their brothers and sisters and families. Enough is enough, and that's what we're here to talk about today. What do we do when enough is enough? For years, IHS has been asked to make improvements. Congress has increased the agency's funding every year that I've been in office, and yet the situation is as bad as it's been. And let me be very clear, I do believe that Native American health care is underfunded. But I also believe that money is not going to fix the broken management system that we have in the Great Plains region. So let's talk about solutions. I thank the chairman and the senators for introducing the IHS Accountability Act in the Senate. Like the bill that I've introduced in the House, this legislation tackles serious personnel problems that are plaguing IHS, including the agency's hiring, firing, and disciplinary practices. It also includes many incentives for the recruitment and retention of high-quality employees. My bipartisan Health Act that I've introduced in the House has many sponsors on it already. It will be having a hearing in the coming weeks, but it also takes a similar approach. But I also added something that is the third rail of delivering high-quality health care to people in Indian country. It's the Purchased Referred Care Program, and we've already talked about that today when we had some discussions with tribal leaders. Don't get sick after June has become a common phrase in Indian country. And it's because the Purchase Referred Care program runs out of money in June every year. And after that, the only way that you're going to get any kind of treatment or care is if you're dying or losing a limb in Indian country. It's unacceptable. It's jeopardized tribal members' lives and personal well-being as well as their financial health. The reforms in my bill ensure that funding is fairly distributed among tribal communities and ensures that South Dakotans can get the care that they need. So, Mr. Chairman, I'm encouraged by the fact that we've already got broad agreement between the House and the Senate on solutions on pervasive problems. I'm looking forward to working with you and my delegation colleagues, the House Natural Resources Committee, the Energy and Commerce Committee, Ways and Means Committee, and unite the two approaches to have a comprehensive solution we can put on the President's desk. And that's what I fully intend to do, is to get solutions signed into law so we can fix this problem. I yield back, and I want to thank you again for allowing me to participate today.
Thank you.